for you. Soup and toast.
Soup and toast before the big day. Harry and Ranjan are keeping it simple. The celebrations will come tomorrow when they become some of the first in the world to be vaccinated against coronavirus.
When I received the telephone call, I was very excited. I got the opportunity of joining in and taking part in that. So we are very, very pleased and happy and excited as well.
When he told me, then I said, what about me?
Thousands of others will join them for jabs in hubs like this London one. From Inverness to St Ives, the UK is starting the biggest global vaccination programme in history. NHS staff here have been practising the drill for days. The spotlight will be on them and their boss as the health service takes charge of the mass rollout.
Hospitals and then GPs and pharmacists, as more vaccine becomes available, are going to be vaccinating at least until next spring. So in the meantime, we're going to have to continue to be very careful. But if we do that, I think there's every chance that we will look back on tomorrow as marking a decisive turning point in the battle against coronavirus.
Vaccinations will be administered at dozens of hospital hubs from tomorrow. Care home workers and those over 80 who are in hospital or who have an appointment will get it first. Any spare appointments will go to key NHS workers. All 4 nations are aiming to vaccinate care home residents before Christmas.
Delighted to know that I might or I will protect, myself, my family members, my patients, and all my colleagues here.
Everyone who is vaccinated will get one of these cards. It's pretty standard practice in the NHS as a reminder for your next appointment. But this one perhaps will hold a little more symbolism. It isn't an immunity passport, but it will at least give everyone who's got one peace of mind.
It doesn't mean the virus will disappear, though. Crowds like this over the weekend had to be broken up, and there are fears others could follow.
We're not there yet. It's so important that people keep doing the things we know we need to do, following the rules and the basics to make sure we keep this under control. But we can now see the light at the end of the tunnel.
We can indeed. As the vials continue to arrive at hospitals, the countdown to V-Day begins.